The coronavirus pandemic has affected our lives, our economy, our health, and has spread to every part of the globe. The rapid spread of new variants offers clues as to how the SARS-CoV-2 is adapting and how the pandemic will play on over the next several months. WHO said the highly mutated Omicron variant of COVID-19 could change the course of the pandemic. Due to the previous lockdown and work-from-home culture, people's lifestyles are already severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Beat Diabetes Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. If you have any questions you would like to ask them, send them to us via WhatsApp to the following number +91 9167 666 941. That is the number to send us your questions for our experts. Do also send us your name and your location. Let me introduce the guests to you for our show today. We have with us Dr. M R Vidhya, MBBS, DNB, Internal Medicine, Chief Consultant, Physician and Diabetologist, Founder and Medical Director, MVR Medical Center, Puducherry. Dr. Vikas Kumar Srivastava, MBBS, DNB, MN, AMS, F Cardio, D Diab, Consultant Physician, Dr. Vikas Diabetes and Obesity Center, Prayagraj, and Dr. Nirag A Tupkar, MBBS, DNB Medicine, DNB Cardiology, Consultant Interventional Cardiologist, Indore. Thank you all so much, doctors, for joining us today on this very interesting topic what we're going to be talking today. Starting with you first, Dr. Vidhya, what do we know about the Omicron variant and how does it affect children and teenagers? Are the current vaccines effective against the Omicron variant?
Yeah, first of all, good evening. We are in the third year of the pandemic, and in the current wave, Omicron is the predominant variant seen in about 80 to 85% of cases in many of the metros. Omicron compared to Delta or any other variant is highly contagious, but it is milder. So Omicron causes upper respiratory infections, mainly nose and throat infection, that is. Lung involvement is less and hypoxia is less. And with Omicron, the number of hospitalizations, need for oxygen therapy, ventilator therapy, and then ICU admissions, deaths, everything is less. So this is one positive aspect we can take from Omicron. Then when it comes to the kids, yeah, it is milder. It causes typical upper respiratory tract infection symptoms with fever, cough, cold, sore throat. Then it also causes diarrhea in about 10% of kids. It causes skin rashes in about 3% of kids. And there is a peculiar COVID dose described in this pandemic where it causes some reddish patch on the toes. Okay. And rarely there is fits. And very rarely there is multiple inflammation of the multiple systems of the body, MISC, where there is involvement of heart, involvement of nerves and brain, and severe lung disease and even death. But this is very rare, occurs mainly in those children with some comorbid conditions like congenital heart disease or post-transplant children, or who have steroid therapy or cancer chemotherapy like that. And coming to the vaccines are quite useful and they are safe in children, and it has been found in phase 2 and phase 3 trials. And WHO has approved vaccines right from the age of 2 years. So this also shows the efficacy of our Indian vaccines. And I can add one more point, that is vaccines are quite useful in adults also, but not better than Delta. So what we are suggesting is adding a booster to needed high-risk patients reduces the risk of severe infections very much, and risk of ICU admissions and deaths also very much.
Yes, absolutely. I think vaccination is key here. I think we all know that. Dr. Srivastava, people in India have taken the Covaxin and the Covishield vaccines. Are these vaccines effective against this new variant Omicron? And what is the difference between a booster dose and a third dose? Because a lot of time one's wondering that is it the third dose or the booster? So can you help us clarify that?
Yes. So that's a very good question. The vaccines are definitely effective for preventing the severeness of the disease. But yes, people are getting infected who are already, having double dose of vaccines, or in fact, some have taken booster doses also. So we cannot say that it is completely preventing from infection. But yes, the severity is very less who are already vaccinated. But yes, definitely every people should follow the proper COVID protocols, which already have told many times since last 2 years, like proper hand hygiene, using mask, social distancing, everything. And coming to the second question, yes, there is a clear cut difference between booster dose and the third dose. So the third dose is a common routine dose which can be used in some immunocompromised patients. Immunocompromised like cancer patients, HIV patients who are on steroid therapy. So such patients are having a decreased immunity. So for them, an extra dose is required, which is called third dose. Coming to booster dose, yes, it is a something, the dose which is to maintain the immunity of the current dose. Like we have already taken 2 doses 6 months back, 5 months back. So we need a booster dose just to maintain the same immunity to fight with the virus in coming days. So this is the difference between the two. So I hope everyone is very much aware of the vaccine, very much aware of the COVID protocols. They should definitely follow these guidelines to prevent themselves from infection first, and then only we can say that vaccines are effective.
Absolutely. Yes. I think along with vaccination, protocol is extremely important, and what you rightly explained, that there is a difference between the third dose and the booster dose. Thank you for explaining that. Dr. Tupkar, what are your treatment options if you are infected by Omicron infection? Are the treatment options the same with earlier variants? How does one differentiate the treatment?
So we have to understand that the Omicron infection itself is not a very severe disease. As Madam has already rightly pointed out, the severity of the disease is not as bad as it was with Delta. The hospitalizations are fewer. So basically, most patients usually need symptomatic treatment. Along with symptomatic treatment, there are a few patients who may come in with severe disease, like they may have low oxygen levels and as such, or they may the other things, which is respiratory rate and other things. If somebody has severe disease, the treatment options more or less remain the same. So we are still treating them basically with anti-inflammatory measures like steroids and other things. Along with that, the symptomatic treatment continues. We have a new drug, molnupiravir, which came out recently, and for mild disease, which is now being used widely for mild disease, even in Omicron. But most of the patients usually do not need do not need any specific therapy. Many times they just do well with symptomatic treatment, and there are only few cases which need hospitalization or oxygen support, or higher support in the form of ventilation and as such. So Omicron is usually a milder disease as compared to Delta was.
Okay, milder for sure, but transmission rates are high, so we need to be even more cautious. Dr. Vidhya, whenever we talk about diabetes, we talk about insulin resistance. What is insulin resistance and how does it develop?
Yeah, insulin resistance is a very common terminology now used with pre-diabetes and diabetes, even by lay people. And insulin, we all know, it is the hormone secreted by the pancreatic beta cells to control the normal blood sugar levels. So what insulin does is it acts like a key to push the blood glucose we derive from food into the cells of the tissues like muscles, fat and liver. So insulin acts like a key, but in certain conditions, these tissues have reduced capacity to respond to insulin's action. What we can say, the tissues are little resistant to insulin's commands. This condition is called insulin resistance. What happens here? Here the cells do not allow the glucose to go inside. So the cells are also deprived of energy. At the same time, the blood glucose tends to rise. So this leads to a condition called hyperglycemia. So to counter this, what happens? The pancreas secretes more and more insulin to overcome the insulin resistance, and that's how blood sugar is maintained. But over years of insulin resistance, this condition cannot be corrected by pancreas, and that's where the frank diabetes sets in. So insulin resistance is mainly due to abdominal obesity, we can say, accumulation of fat in the abdomen and internal organs. That is called visceral fat. This visceral fat is the main contributing factor for insulin resistance. So if a person loses this fat by weight loss, reversal of diabetes is also possible. Nature gives us that much time to reverse diabetes also by countering the insulin resistance. Okay. This insulin resistance is seen in obesity. We saw physical underactivity, then sedentary lifestyle, that is sleep deprivation also, smoking, then certain conditions like polycystic ovarian syndrome and fatty liver.
Yeah, so one must really take care of these other things as well, what you said, right? Obesity, weight loss, eating well, exercising, So Dr. Srivastava, tell us, high as well as low birth weight can lead to type 2 diabetes in the future. How does birth weight affect the risk of developing type 2 diabetes mellitus?
Yes, very rightly said. Low birth weight, high birth weight, both definitely can lead to diabetes in future. High birth weight is definitely related with development of obesity later on, which can directly correlated as risk factor for diabetes. So that is very sure. For low birth weight, yes, babies with low birth weight can have different kind of metabolic disorders later on, which can lead to obesity, which can lead to insulin resistance. As Vidya ma'am was already discussing about insulin resistance in detail. So insulin resistance is something which can trigger out the development of diabetes. Obesity is another risk factor for diabetes. So there are chances of having these risk factors in future life, which can lead to diabetes. And yes, birth weight is directly related, but the gain in birth weight is also directly or indirectly related with development of diabetes. So it is better to advise each and everyone, in fact every parent, to take care of the birth weight and the further weight of their child on check. Because if they are going to be obese or overweight, definitely there are increased chances of developing diabetes. So it is very important to have a check on your weight.
Okay, of course it's important to keep a check on that. Dr. Tupkar, we've spoken about diabetes, we've understood about insulin resistance. If I can talk about the heart, how does heart disease affect women differently from men, and are the symptoms of a heart attack different for men and women?
So this is a very important question as far as, in our, particularly in our Indian scenario, because what happens is what we find many a times is that, women, especially in the rural areas, they are a very neglected and ignored lot. Many times women in our country, they tend to bear a lot. They go through a lot of, pain or sometimes suffering, and they do not complain. So they present to us very late. If we look at the incidence of heart disease, the incidence of heart disease is very less in premenopausal women. The menstrual cycle or the hormones itself, they afford a natural protection to women as far as development of atherosclerosis, which is the primary cause of coronary artery or heart disease. But as menopause, after menopause, the risk in men and women is almost the same. Okay. So we have to, after menopause, it's important for women also to undergo annual checkups if possible. Another thing is the symptoms of heart disease are very atypical as far as women are concerned. They do not have the classical chest pain or the pain which radiates to the left arm or the jaw. Many times these they come with acidity-like symptoms or back pain or nausea or vomiting. And only after an ECG is done, we realize that the lady is suffering from heart attack. And also, as far as presenting to us, many times, as I said, they keep bearing a lot. So they keep bearing and they don't come. And they present to us very late when, things are beyond. So when their pump failure has already developed. So this is one thing where we have to actively, go out and reach out to ladies where we, we examine them annually or so. Or maybe a program as such can be formulated.
Sure, I think so. It's important what you put out there, that it's important that women don't take any symptoms lightly. And I think more important is that to get preventive checkups done. So on that note, we're going to be taking a short break. We'll be right back. Welcome back. You're watching Beat Diabetes Myths and Facts. Dr. Vidhya, is only blood sugar control sufficient for the effective management of diabetes? If not, what are the other factors that should be controlled?
Yeah, actually, just control of mere numbers with few pills is not going to be diabetes management. One has to maintain this blood sugar control throughout the life, and there should be a regular monitoring of blood glucose as well as glycosylated hemoglobin to know whether the control is good. Then diabetes comes with bad companions. That insulin resistance we discussed, no, that also leads to high blood pressure, high cholesterol levels, and coronary artery disease. That is called deadly quadrant. So this blood pressure should be checked. If it is more than 140/90 on several occasions, 2-3 occasions, we have to consider treating that. Like that, high levels of triglyceride, a type of fat, more than 150 milligrams in diabetics should be considered for treatment. And then more than 100 milligrams of LDL or the bad cholesterol should be considered. And when the HDL or the good cholesterol level drops to below 40 milligram per DL, we have to consider treating. We can treat by diet, physical activity, and drugs. Then also we have to look for silent complications. Diabetes, you know, is a silent killer. So diabetes can cause silent changes over years in the small and large blood vessels of the various organs. So diabetes is the leading cause of non-traumatic amputations all over the world. And diabetes is the leading cause of end-stage kidney disease requiring kidney transplantation. And diabetes also causes the majority of people die of heart attacks. And diabetes is the second most common cause of vision loss in India, next to cataract. So you know the importance. So we have to screen yearly for involvement of eye in the form of retinal screening or fundus photograph. We have to check for the leg involvement, neuropathy. We have to check for kidney involvement, that is nephropathy, and ECG and an echocardiogram. So many simple tests are there to detect complication, this silent complication. Last but not the least, we should also ask the patient to quit smoking and tobacco in any form, and also to stop alcohol, because these two are like poisons. When you treat diabetes, the effect will be nullified when the person continues to smoke or drink. So that has to be stopped to prevent nerve and blood vessel damage.
So I think some important points you've put out there, Dr. Vidhya, I think very, very critical in fact. Dr. Srivastava, how does obesity affect the risk of developing type 2 diabetes mellitus? At what BMI does the risk for type 2 diabetes mellitus increase?
So that's very important. See, obesity is nowadays becoming a major risk factor for so many diseases, you know. So not just diabetes, obesity is causing different kind of diseases, like it has increased chances of hypertension, cardiovascular diseases, as Vidya ma'am was saying, bad companies, dyslipidemia. So lots of factors are there which can lead to different metabolic disorders, different kind of diseases related with heart, kidneys and everything. So it is very important to have check on obesity to control weight. Coming to the second part of the question, yes, for BMI criteria, Asian population has different BMI criteria. From 18 to 23, they are called normal weight, normal BMI I mean. From 23 to 25, they are overweight, and from 25 to 30, beyond 25 I mean, and they are obese. Okay. Likewise, in Western countries, 18 to 25 is normal, 25 to 29 or 30, it is kind of overweight, and beyond 30 is obese. This is a rough idea. So we have seen there are changes in increasing fold of chances of having diabetes. For overweight, around threefold increase are there if patient is under overweight category of BMI, and if they are under obese or more than 30, more than 25 according to Asian population, so they are having 7 to 8 fold chances of increased development of diabetes and other complications. So it is very important to have a right calculation of your BMI. It is very important and very easy to calculate BMI from any kind of application from your mobile. You can easily calculate. So BMI is something for general knowledge of our audience. This is very important to have a check on BMI. BMI is very simple. Your height and weight, you can calculate it from a calculator given on the site. And do check that either you are under a controlled BMI or you are overweight or you are obese.
And like you
accordingly
mentioned,
can
it's
set your
easily, and like you just mentioned, doctor, it's easy to check your BMI. So I think that will be an important tip for our viewers. Dr. Tupkar, cardiac procedures can be exhausting emotionally as well as physically. How is cardiac rehabilitation beneficial for these patients? Does cardiac rehabilitation improve quality of life?
So I agree with you completely when you said that they are, they are emotionally and physically draining. As far as the physical procedure, physical part is concerned, there are the newer techniques where we are invading, where we are doing the surgeries through minimally invasive techniques. To a certain extent, it does cause lesser physical, problem to the patient. But as far as the emotional aspect of it is concerned, cardiac rehab program actually is a comprehensive program which involves a physician, a diabetologist, a dietitian, a physiotherapist, and I also tend to, I also tend to highlight that we in our country usually do not focus on the emotional or the psychological part of it. Many patients who first time suffer from any heart attack or any cardiac issue as such, or say a valve problem, if they are diagnosed with it suddenly in their life first time, many times they do not cope up with it, and it causes a lot of mental drain, where there are patients who land in depression. So it's important that a psychologist or a counselor is also involved, who keeps consoling and encouraging the patient that things are going to be all right. So it involves a big team of people. There is a significant role of a regular exercise program, a proper diet program, which it goes a long way, and it not only improves the mortality, I mean it lengthens life, but it also significantly improves the quality of life of patients, where they, in the form of a lesser number of recurrent hospitalization. Many times people who have heart failure, they have to get admitted again and again because the symptoms keep on increasing. But if they are enrolled in a cardiac rehab program and they are properly compliant with it, the incidence of rehospitalization and readmission has also significantly go down.
Yeah. No, thank you so much, doctors, for sharing all this with us. And I think the crux of it is that we need to take care of our health, whether it's eating right, sleeping well, giving up bad habits like Dr. Vidhya said. Thank you all so much, doctors, for joining us today.